The new prenatal program of Clalit is about to be started. We are going to give the full services in the primary and in the healthcare centers in community, both in urban and rural regions. And we are training our staff, especially nurses and also physicians, to be part of this program using new technologies and new tests in order to detect early problems and to treat them.
With the new means and technologies, biochemistry, sonography, molecular medicine, we are able now to do more and more prediction and thus maybe to lead to prevention of various complications during pregnancy. We call them today the great obstetrical syndromes. Preeclampsia, which means hypertension in pregnancy. Gestational diabetes, GDM, which means carbohydrate intolerance during pregnancy, which is very, very important now as a marker for acute complications during pregnancy for the mother and the fetus and the offspring, but more and more emerge as a complication that predicts type 2 diabetes, and we have now more and more preventive measures to prevent type 2 diabetes.
We are launching the program because I believe that we have to change the concept of care of women. We want to offer the Israeli women a comprehensive women health care center that will accompany them through the life cycle. In one-stop shop, we will offer services including pregnancy care, genetic screening, and diagnosis, including innovations such as non-invasive parenteral diagnosis, endoscopic procedures, whole spectrum of infertility services, sonographic services, sophisticated breast clinic and sonography, menopause clinic, and lifestyle intervention.
As a flagship hospital of Clalit Health Services, it's quite natural that we are also a leader in obstetric care. We have the most difficult cases of women after heart transplant, after lung transplant, people that have been survivors of cancer treatment. Those cases are everyday cases in our obstetric department of 9,000 deliveries each year. It is natural for us to share the challenge of treating obesity, hypertension, diabetes, to have a good track of those women at their first trimester, diagnosing them. Due to very good communication, same electronic medical record between the hospital and the community, I am sure that we shall be able to accept those pregnant women at the right time, at the right place, to provide them a proper treatment and hopefully send them safely to a good medical community which are in very close contact with us. Death rate of children under the age of 1 year is 4 times higher than the Jewish population. 43% of the deaths are caused by hereditary condition and/or birth defect. This population is ranked last in the Israeli socioeconomic ranking. We undertake many different activities to deal with the challenges and to enhance the compliance of our patients, many reaching out. For example, pre-gestational generic screening and counseling, mobile unit that provides in-house medical care, mobile gynecologists that travels around the villages and provide primary care gynecology and obstetrics, health education, healthier lifestyle, women's health, child health, hygiene, diabetes, smoking rehabilitation, etc. We also educate our staff for a better understanding of the spatial characteristics and conditions of the Bedouin. For example, Arab language courses, cultural adequacy course, genetic courses. Clalit Health Services Gestational Diabetes Program will start in July. The program implies universal diagnosis of GDM using the new diagnostic criteria recently endorsed by the WHO, IDF, and now revised by the FIGO. We act in this area every day. For example, 62% of Bedouin pregnant women perform the glucose challenge test. 30% of Bedouin pregnant women with a chronic illness encounter the pre-gestational counseling and genetic screening, as opposed to 13% only in the Jewish population. Of course, we still have a long road ahead of us.
Clalit Health Services decided to deal with this issue, hoping that by creating a healthier next generation, we will lower the prevalence of chronic diseases in the population and will get a lower cost total health for the organization and for each person in Israel.